Welcome to Dr. Ruscio Radio, discussing the cutting edge in health, nutrition, and functional medicine. To make sure you're up to date on this and other important topics, visit drruscio.com and sign up to receive weekly updates. That's drruscio.com. The following discussion is for educational purposes only and is not intended to diagnose or treat any disease. Please do not apply any of this information without first speaking with your doctor. Now, let's head to the show.
Hey everyone, welcome to Dr. Ruscio Radio. This is Dr. Ruscio. Today I'm here with Dr. Dr. Brandeis, and we're going to be talking about, amongst other things, shockwave therapy, which is like a little mini wave, almost like a jackhammer for your genitals that can help increase blood flow, in addition to kind of male health as a general topic. So Judson, thanks for being on the show today.
Oh, it's my pleasure. Thank you for inviting me.
Yeah, it's always good to talk about a subject that I think doesn't get enough attention on the internet or just in general, which is male health. We hear more about female health, and we probably don't hear much about male health because it's our own fault, because as men, we don't like to talk about it, but it's certainly something that I'm sure there are men out there, perhaps some suffering in silence, who could use a little bit of a tune-up.
Well, we tend not to hear it until it's too late. So it's much better to be proactive about these things. There are things that we can do these days to forestall the inevitable. Yes,
and so let's get into some of this. But I guess before we do, tell people about your background and how you got into. I mean, you're training conventional medicine, but now you're doing some, I guess you would call them, not in the typical conventional box therapies, and you've expanded and you're a bit more progressive. So tell us a little bit about your background and then how you got to this broader model of urology that you're now in.
Sure. So, I'm a board certified urologist, and I went to medical school at Vanderbilt Medical School. But during medical school, I got a Howard Hughes sponsored research fellowship to go up to Harvard Medical School to do research on kidney transplantation. And I worked in a lab where they won the Nobel Prize for doing the first successful kidney transplant, and did a lot of research on transplant immunology. I thought I was going to be a kidney transplant surgeon. And I learned a lot about how to do research, about immunology, about transplantation. I went back to medical school, decided to become a urologist because urologists do kidney transplants. I started doing urology at UCLA and decided I didn't want to do kidney transplants. I wanted to do general urology. When I got out into practice in Walnut Creek, California, I found that I was really fascinated by technology, and I was one of the first doctors in the country to use the Da Vinci surgical robot to do robotic prostatectomies. I was a pioneer in using lasers in urology, a pioneer in using MRI technology. I'm just kind of like a gizmo kind of person. Mm-hmm. And so then I read about using shockwave therapy for erectile dysfunction. I was initially really skeptical, like, could this actually work? And so I delved into the literature. I researched it. I flew out to Miami. I got trained in GAINSWave, which is the brand behind shockwave therapy. They basically popularized shockwave therapy. They ran the early training courses, and I came back to Walnut Creek, and I decided I was going to bring this to Northern California.
And for those in the audience who are used to kind of the very scientific narrative, we'll go through some of the high-level science on the GAINSWave and shockwave therapy devices in a little bit. But before we get there, let's touch on why male erectile function is a proxy for overall health, because I think we can view it at least partially as such, but I don't think everyone fully understands that, if a male is not having optimal erectile function, that's a symptom of more, I guess you could say, global dysfunction or potentially another system dysfunctioning. And that's kind of an alarm sign. It's not just something that's inconvenient and maybe at times embarrassing. It's a signal to something deeper that needs to be looked into.
No, I think that's really a critical point. And I think if anyone learns anything from the podcast today, I think that's the most important thing to learn. Because the coronary arteries, so the arteries that go to your heart, are basically the same size as the penile arteries and the internal pudendal arteries. And so if the arteries in the penis are getting clogged, there's a pretty good chance that the arteries in the heart are getting clogged.
So certainly one of the first things we want to think about is coronary health. Are there any other major factors that one may want to look into as a flag if they're noticing that their erectile function isn't optimal?
Well, so your normal blood pressure is, say, 120/80, but the arteries in the penis generate blood pressures into the 300s. And so that would be one of the first things to go, is erectile function. And so if you're in your 40s or 50s, even early 60s, and you begin to get erectile dysfunction, it may make sense to go to your primary care doctor, let the primary care doctor know. And instead of just getting put on Viagra, maybe it's time to take a trip over to the cardiologist to get a stress test or check your lipids, or just basically an overall health check to make sure that everything's okay.
Now, what about when you see this occurring in men who are younger? Are you thinking non-cardiovascular causes more so?
It's all over the map. There's so many different causes of erectile dysfunction. I mean, sometimes people get diabetes early on. Some people are obese. Some people are smoking. Some people are drinking heavily. Some people are smoking marijuana. Even some people have pornographic addictions. Some people have like neurologic diseases, multiple sclerosis. And so it's important, if this is going on, to figure out what the underlying cause is.
Okay. And are there a few that you find to be the most common? I mean, I'm assuming that stress, sleep, and a healthy diet are fairly foundational, as is probably exercise. But outside of some of those things, are there a handful of others that you find fairly commonly?
It's mostly cardiovascular disease that isn't initially recognized, whether it's because they have a family history or because of poor diet. And the other issue that people don't understand is that, if you're going to play in the country club tennis tournament and you want to win your tennis match, you don't drink a couple of bottles of wine, have a big meal, and wait till 11 o'clock to play your tournament. You want to optimize your health and your blood pressure. You want to drink a lot of water. You want to be well rested. And so, the issue is a lot of guys will try to have erections, at 11, 12 o'clock at night, but that's not really the optimal situation for that kind of situation.
Mm-hmm. Okay. So tell us a little bit about what shockwave therapy is for, and I'm sure most people haven't even heard of it. So, take us from the floor up here.
Right. So these are shock waves. They're not sound waves. Sound waves we use for diagnostic purposes, and they're very kind of smooth sinusoidal waves. So shock waves are more of a pulse wave. And what shock waves do is they perturb the cell membranes. And when the cell membranes are perturbed in a certain way, it sounds the alarm. And the alarm that cells send out is the same alarm that they send out in trauma. So it would be like the cells are being traumatized by some sort of injury, but the injury is actually not occurring. It's just sound waves. Okay, when the cells get injured, they generate an inflammatory response. And in the body, an inflammatory response is a healing response. And so part of healing is growing new blood vessels. And so your body produces what's called VEGF, which is vascular endothelial growth factor, and other growth factors that generate blood vessels and generate stromal tissue inside the penis that help support the delivery of new blood vessels and increasing the size of existing blood vessels in the penis so that you can get better penile blood flow.
So in a way, I mean, this is a very, I guess you could say, one of the most foundational ways of supporting healthy erectile function, where you're actually stimulating through almost like a hormetic stressor this repair and new blood vessel angiogenic process to get more blood to where you need it.
Exactly. I mean, it's a totally natural process, and it's really one of the only curative treatments for erectile dysfunction. So, if you take Viagra, the effect is temporary. If you do injection therapy, the effect is temporary. If you use vacuum erection devices or an implant, the effects are basically temporary. This actually is curative.
Hey everyone, I'd like to thank two companies that can help you to improve your health and have also allowed this podcast to be possible. Firstly, GAINSWave. GAINSWave therapy can help enhance sexual function by using sound waves similar to ultrasound to both stimulate angiogenesis, or the growth of new blood vessels,
and break down plaques in existing blood vessels. And GAINSWave has been shown to improve erectile function in men according to 2 meta-analyses, and there have also been 40 clinical trials showing various degrees of favorability in using GAINSWave therapy. I personally have done 1 round, and I have been very happy with the results of GAINSWave. So if you're a man suffering, I would not go any longer suffering, and I would definitely give GAINSWave a look. They have a offer of 1 free GAINSWave therapy session if you visit gainswave.com/patient. And for medical professionals, if you want to learn more, you can go to joingainswave.com/provider. That's GAINS, the spelling of GAINS. Also, Platinum LED, who makes perhaps the best red light therapy unit on the market. And red light therapy can improve your health by stimulating mitochondria, which make energy for your cells. Now, the research, while preliminary, has shown encouraging results for an array of applications with red light therapy: thyroid, skin health, anti-aging, joint pain, and body composition, to name a few. And I've also been using a Platinum LED unit at home, and so far I'm really liking it. I do feel like my skin looks much healthier and, as has been documented in some of the studies, can reduce wrinkles. Now, in a direct side-by-side test, Platinum LED lights have produced the highest radiance of any LED light on the market today, and I'll link to a cool video for this in the transcript. And this is the coolest part. All of their lights come with a 60-day trial period and a full 3-year warranty. They're offering $50 off certain products at platinumtherapylights.com. If you use the coupon code RUSCIO50 at checkout, that's RUSCIO 50 at checkout. Check them out.
Right. And so that's a nice transition. There are 2 meta-analyses or 3 meta-analyses. I just want to give the audience, because I know people are curious about the scientific support. 3 here that I'll just give you the names of, and we'll include the links in the show transcript. Low intensity extracorporeal shockwave treatment improves erectile function, a systematic review and meta-analysis. And to quote them, we reviewed 14 studies of men who received low intensity extracorporeal shockwave treatment for erectile dysfunction. There was evidence that these men experienced improvements in their ED following the procedure. Another meta-analysis, essentially I won't bore you with the title, but I'll give you the quote. In this meta-analysis of 7 randomized control trials, treatment of LD with shockwave therapy resulted in a significant increase in essentially sexual function scores. And there's a third entitled low intensity shockwave therapy for erectile dysfunction. Is there strong enough evidence? And essentially the conclusion they come to is there's some preliminary evidence showing benefit, but more research is required, which I think is totally reasonable for a therapy that's a bit newer. But what I'm trying to impress upon the audience is that there have been clinical trials performed and they have shown benefit. Does this mean a 100% benefit rate? No. And that would be really fantastic. It would also be highly unlikely. But there's definitely, I think, at least a solid body of preliminary evidence showing benefit from this therapy. And let me throw it over to you, Judson, now, because you're performing some of this research. So how would you comment on the body of literature?
Sure. So, first of all, the easiest place to find that body of literature is to go to the GAINSWave website. And the GAINSWave website basically lists every single paper that's ever been published on shockwave therapy. So it's a very easy place to find all this data. But, very recently I've been asked to be the Director of Clinical Excellence for GAINSWave. And it's a great position, because what I'd like to do with that position is to lead clinical research on shockwave therapy. There are a lot of guys out there, not a lot, but there are a few guys out there that are doing really excellent scientific research. There's Tom Liu at UCSF, and he actually does acoustic shockwave therapy on rat penises. Really kind of
weekend hobby.
Yeah. But he actually does this, and then he sacrifices the rats and they stain for stem cells. And they find activation and proliferation of stem cells in these rats that have been subject to acoustic wave therapy. Now, what I'm more interested in not is rat penises, but actually human penises. And we're going to do some really large scale studies, because there are almost 350 GAINSWave providers around the country. And so we can do very large clinical studies. One, to figure out exactly what the best protocol is. Is there a best machine? Is there a best number of shock waves? Is the intensity or frequency of the shock waves, is that important? And then the other thing is, who doesn't do well? Do type 1 diabetics do well? Do patients who've had prostate cancer surgery or radiation do well? There are a lot of unanswered questions. This is kind of a wide open field. And really, I would like to be part of the scientific effort to answer these important questions. What we do know is that 75 or 80% of patients will get good results.
Yeah, and that's. I mean, as far as therapies go, that's a pretty good, just for the audience. I mean, at least I can speak for the body of knowledge I have the most familiarity with, which is research in gastroenterology. That's a very good response rate, 70 to 80%.
Mm-hmm. And, there are patients that come in that I know aren't going to be effectively treated by 6 treatments, which is kind of our starter dose. And I tell them pretty much up front, you're going to need 12 treatments, or you're going to need 12 treatments and what's called the P shot, or platelet-rich plasma.
Yeah, so let's talk about that, actually. And that's a good segue into other therapies that may also help with erectile function. And, they may also be synergistic with the GAINSWave. In fact, I know you're kind of doing what you term triple therapy. So let's talk about that.
Yeah, so, when I started doing shockwave therapy, I was very skeptical. I was interested, but I wasn't really convinced that it worked. And so I was kind of racking my brain, what can I add to shockwave therapy to help it work better? And when I was at UCLA, there was a doctor named Dr. Lou Ignarro who won the Nobel Prize in 1998 for the discovery of nitric oxide as a second messenger. And he had a chance meeting with one of my professors, Jake Rafer, in a stock elevator. And that chance meeting resulted in a collaboration, which resulted in a New England Journal paper showing that nitric oxide was the second messenger system that was used in Viagra or sildenafil. So nitric oxide was always on my radar. And so I said, well, maybe a nitric oxide booster will increase the chance of success, because basically increasing nitric oxide will increase the signal that gets sent to the blood vessel. And then if you're improving the signal and you're improving the blood vessel, then those two things work synergistically. And then on top of it, if you take a low-dose PDE5 inhibitor like Viagra or Cialis, then you have increasing nitric oxide boosting, and you're blocking the uptake of nitric oxide, and you're improving the blood vessels. So that's how we developed what I called Affirm, and you can pick up Affirm at affirmscience.com. But Affirm is L-citrulline, which is the most potent nitric oxide booster, and L-citrulline is basically watermelon, red beet extract, Mirapuama, which is a Brazilian root, which is a strong nitric oxide booster, and Asian ginseng. And we use those 4 compounds because those are all compounds that there are very good scientific data behind those 4 compounds. We didn't want to fill the supplement with all sorts of vitamins and minerals that there are really no data for, that are basically just fillers. Those 4 are the only ones that I could find that have real legitimate scientific data.
And you chose citrulline, L-citrulline, over arginine because there's essentially there's less of a regulatory impact from the body on L-citrulline compared to
Right.
arginine.
Well, the problem with L-arginine is if you take L-arginine, it gets metabolized. Mm-hmm. And so by the time it hits your body, it's decomposed, and the only thing it does is actually drops your blood pressure. So L-citrulline is actually converted to L-arginine in the kidney, and then L-arginine, once it's in the bloodstream, becomes the nitric oxide donor, and then it's actually recycled back to L-citrulline. There's a little circuit in your body.
Mm-hmm. And you also mentioned PRP. So for people who haven't heard of PRP, tell them a little bit about what that is and how it works, and how you're using that in the application of sexual function.
Right. So, there's a whole field of regenerative medicine. And to be honest, we really don't know very much in regenerative medicine in terms of stem cells and growth factors. We know that there are stem cells. We know that there are growth factors, but we don't really know exactly how to activate them. And in fact, the Sexual Medicine Society of North America came out with some basically warnings that PRP and stem cells are experimental, or there's not all that great evidence that they work. But there's a spectrum of regenerative medicine that people use. So one thing is called PRP, which is platelet-rich plasma, also popularly known as the P shot. And PRP is used for the P shot, it's used for the O shot, it's used for hair growth, it's used in orthopedics. It's fairly widespread in use. So basically what it is platelets are round, okay? But if you cut yourself, it's hard for round things to form a clot. So when platelets become activated and get signaled to come to a site of an injury, they reach out their arms. And so instead of being round, they become like starfish. And the arms of the starfish join the other arms of the starfish and form a web. And that web then catches thrombin and complement and other factors that create a clot. But it's a really amazing system because when the platelets open up their arms, they release something called alpha granules. And alpha granules are loaded with growth factors. So if you ever wondered why when you cut yourself, your skin grows really fast there, and the skin doesn't grow anywhere else on your arm or your leg where you cut yourself, it's because the platelets are releasing growth factors, and those growth factors are stimulating the growth of tissue there through vascular endothelial growth factor, epithelial growth factor, keratin growth factor. All sorts of growth factors are being released in that area. And so what PRP does is it takes advantage of those growth factors. And so what you do is you draw blood, then you put the blood in a centrifuge, and when you centrifuge it down. Now, when you centrifuge blood, the red blood cells have iron, and so the iron goes to the bottom. The plasma, which is basically the water that the blood floats in, goes to the top, and then you have a small layer in the middle, which is basically platelets and white blood cells. And so you take out the platelets and white blood cells, and then you inject it. And you can inject it into the hair for hair growth, or in the penis, basically for growth of the penis or stimulation of the growth of blood vessels. And also works really well for what we call Peyronie's disease, which is a disease of scar tissue on the inside of the penis that causes penile curvature.
Wow, so it's being used for that. I didn't know that.
Yeah, and actually it works pretty well.
Great. Well, it must be.
That's a very difficult problem to tackle. So
yeah.
Anything that we have to improve that is really a blessing.
And so just to share my experience with the audience, because I've tried some of these therapies. I've done 6 treatments of GAINSWave over at Judson's clinic. And I have to say, you have a pretty cool clinic. You have a lot of devices over there. Last time I was in, I saw this, looks like a Star Trek chair. And I guess it's for, I think it was for urinary incontinence that uses magnetic stimulation.
It's called the Emcella chair. And it's amazing technology. So I was at the aesthetic show. I sat in the chair for 2 minutes, and I turned to the rep and I said, I need to have one of these. How much is it? They said $120,000. I said, I need to have one of these. So basically, if you take a muscle and you put an electrode on either side of the muscle and you run current through the muscle will contract, right? So our muscles, all have electrolyte gradients, and those gradients create electricity, and that causes contraction of the muscle. But nobody wants to have electrodes on both sides of their muscles. What this does, it's a T2 magnet, which is a very powerful magnet, and it creates powerful electromagnetic fields, which causes massive contraction of the muscles. And so they have the Emcella chair, which is for the pelvic floor. They also have something called the M-Sculpt, which you can use for contract the abdominal muscles or the gluteus muscles. And so it's really interesting because when you go to the gym and you have a really, really good workout, you're working out maybe 30 to 40% of your muscle. But you hear these stories where, a boulder falls on someone and they're able to summon all their strength to move the boulder. And I always wondered sort of how that works. But what happens is you have like a circuit breaker in your brain that prevents you from using 100% of your muscle activity. Because if that happens, you may tear the muscle off the bone. And if you're a caveman and you tear the muscle off the bone, you're not able to hunt food and you're not able to survive. So animals have this flip switch that doesn't allow them to use 100% of their muscle. But if you run current through a muscle, you are able to recruit 100% of the muscular fibers. And that's what these chairs do through electromagnetism. Through a T2 magnet, they're able to massively contract these muscles. It's really amazing. It works great for stress incontinence, for overactive bladder, and for pelvic floor prolapse.
Great. So cool chair. I took a quick gander at last time I was in the office. But like I was saying, I've done 6 treatments with the GAINSWave. And after my 3rd week, I was joking with you about this the other day, I was like humping the furniture. I mean, it was, it was pretty remarkable. And, then I kind of leveled out, but I leveled out definitely at a level improved to, where I was previously. And I could certainly notice increased blood flow. I mean, that without a doubt, that was something that was achieved there. So, for me, I definitely saw some nice results with it. I have not tried the Prp injection into the penis. I haven't quite gotten that bold just yet. However, I have tried it for hair. The other doctor in my office actually has been doing this for a while, and he asked me if I wanted to be a guinea pig, and I said, sure, why not? Jury's out. It's still a little bit early because with the hair, I believe you need to have at least a 3 to 4 month trial, probably closer to 6 to really be able to tell. So it's a bit premature, but just as a I guess as a cliffhanger here for the audience, we're going to be doing a fairly comprehensive section on hair therapies, including hair lasers and PRP. So we'll have more to follow, on that in the future. But so far, my experience with one treatment cycle on the Shockwave, the GAINSWave, has been really promising. So it's something that I can say I've done, and it's you can definitely feel, at least in my case, an improvement in blood flow.
Yeah, no, I think that's great. I'm really happy that you said that. And it's important to understand, what people can expect. If someone's erections are really poor, even on Viagra or Cialis, we're not going to be able to get those kind of patients off the medication. Basically, we can move you up a class. So if you're taking Viagra or Cialis and it's not working all that well, we can get you to the point where it's actually working pretty well. If you're taking Viagra and Cialis and it's working pretty well and you're not able to perform without those medications, then those are the kind of patients we can get off taking those medications. And the other important thing to know is that it's not something that happens typically after the 1st or 2nd treatment. It usually takes about a month because we're growing blood vessels. Blood vessels don't grow overnight.
And that's what was funny about my situation, where I responded. I was starting to notice something at the 2nd week, and I try to always catch myself and say, okay, this could be placebo. But then by the 3rd week, it was undeniable, which you were telling me was pretty fast in terms of response. But being fairly
you're
healthy,
a strong responder.
Yeah. So I'll take it. I also wanted to ask you, Judson, how do testosterone levels tie in? Because I know there's perhaps a bit of controversy in terms of the correlation between testosterone and erectile function. I wonder if some of that controversy is, I guess you would call it, inflated controversy because of the abuse of testosterone in certain circles. I mean, certainly if someone has maybe in the middle of the reference range or higher, I wouldn't think they would be able to gain much from additional testosterone. Clearly, if they're flagged low, that would make sense that they may. I guess where I'm more curious is that borderline low, kind of skirting around the edge of the low range. What are your thoughts in terms of testosterone's impact on erectile function there?
Yeah, I mean, in terms of affecting blood flow, testosterone really doesn't affect blood flow. And erections, for the most part, are circulation. And that's what we're trying to do with the GAINSWave, is to increase blood vessels, increase circulation. That's what we're trying to do with Affirm. And that's what we're trying to do with with PDE5 inhibitors and with triple therapy in general is to increase circulation. Testosterone is much more tied into libido and the desire to have intercourse. And the question of what to do with someone who's borderline low is a really good question. It's something that I struggle with, because once you begin to replace testosterone on someone, you're pretty much stuck replacing it for the rest of his life. I mean, I had a really good lesson when I saw an ex-Oakland Raiders defensive end, this just mountain of a man, 350 pounds. He came in and I examined him. I think I was going to do a vasectomy on him. And his testicles were the size of little marbles. And obviously this guy had been using high-dose steroids for quite a long time. And it basically totally atrophies the testicles. And so at a certain point, your body doesn't begin to reproduce testosterone. It basically loses the ability because you're pumping in a lot of exogenous testosterone.
Yeah, I mean, it seems reasonable to me to conclude that that's not something that you would want to exercise unless all other options have been explored first. But then also, to be fair, and you know this way better than me, so correct me if I'm off on this, but if someone's using HCG at the same time, then they should be able to prevent testicular atrophy and likely keep fertility as something on the table. Would you agree with that?
Yeah, no, I agree with that. But taking HCG is a little bit more complicated than taking testosterone.
Right. And how so do you feel it to be complicated?
To be honest, I don't treat my patients with HCG. I typically, in that situation, I'll refer them to an endocrinologist.
Gotcha. Okay. Hey everyone, this is Dr. Ruscio. I quickly wanted to fill you in on the 3 main resources that are available to you in case you need help or would like to learn more. Of course, I see patients both via telemedicine, via Skype, and also at my physical practice in Walnut Creek, California. There is, of course, my book, Healthy Gut, Healthy You, which gives you what I think is one of the best self-help protocols for optimizing your gut health and, of course, understanding why your gut is so important and so massively impactful on your overall health. And then finally, if you're a clinician trying to learn more about my functional medicine approach, there is the Future of Functional Medicine Review, which is a monthly newsletter, which is a training tool to help sharpen clinical skills. All of the information for all 3 of these is available at the URL drruscio.com/resources. And in case you're on the go, that link is available in the description on all of your podcast players. Okay, back to the show. And I know that the assessment of LH, so just for the audience, LH is released from the brain, and this essentially will tell the testicles to make testosterone. Testing for LH seems to be kind of tricky because it's not a very solid output. It has this pulsation. Pinning some of this down on lab work may be a bit difficult. But again, Judson, I'll defer to your knowledge here. Would you say it's challenging to get a good read on someone's LH levels?
It is. I mean, usually the only time we use it is for fertility.
Right.
That's when we typically check it. But the important thing to understand is that there's a negative feedback loop. So when you take testosterone exogenously, it feeds back onto the anterior pituitary, and it tells the pituitary to stop sending down LH, and it feeds back to the brain and tells the brain to stop releasing LHRH, so luteinizing hormone, releasing hormone. And so that negative feedback loop basically interferes with the natural production of testosterone.
Right. Yeah. So there's no free lunch in biology, and this is why I think we're in agreement when we say testosterone would be one of the last things to consider because of those effects that you're going to have of downregulation of your endogenous production.
Right. But if you're 60 or 65 years old and your testosterone level is 250, and it's also important to check the free testosterone because testosterone is a bound molecule. It binds to proteins, including sex hormone binding globulin. And so you can have a very high total testosterone, but if your free testosterone's low, then it doesn't really matter what the total testosterone is.
Mm-hmm. Yeah, very much so agreed. And for the audience, this is something that I plan on doing more of a direct podcast on just kind of hormone levels in men. One of the things that we're going to be researching is the impact of the liquid chromatography with mass spectrometry method of testing, which if you remember back in our discussions on thyroid, we discussed how that method may be more accurate for cases that might be hypothyroid but don't fully look like it. And by using this dialysis LCMS methodology, you filter out these binding proteins that can confound the results of the free fraction in the blood. So I'm assuming the same thing could apply for, rather than doing your traditional kind of free testosterone via immunoassay, you could do this dialysis with liquid chromatography with mass spectrometry, which filters out some of the binding proteins and gives you a better read. You can also test sex hormone binding globulin in the blood directly. So it's another thing to look at. But these are things, along with an estradiol, that can help give you a picture. For example, if you're too low carb, carbs are anabolic. So if you're too low carb, you could have a very high sex hormone binding globulin, and that could be decreasing your free testosterone. Conversely, if you have some type of inflammatory burden that may be upregulating the aromatase enzyme, you may be converting some of your testosterone into estrogen. But these are things that we're going to explore a little more in a detailed fashion, and try to lay out some thoughts in a subsequent episode. But Justin, anything else on kind of hormones and testing while we're on this topic?
I'm actually working on a supplement to boost testosterone naturally. And so, that's sort of things to come.
Cool. Well, keep me in the loop, and I'm happy to be a guinea pig on that one also, as as I am for many a thing. What would someone expect to pay for this? Because one of the things I'm trying to provide people with this question is how to know if the therapy is reasonably priced or if someone's just jacking it up.
Right. So the standard price for shockwave therapy for erectile dysfunction is $3,000 for 6 treatments.
Okay.
And then typically what I tell patients is 6 months after the initial treatment, you'll come in for one maintenance treatment. So that's $500. Because basically most patients, when they finish treatment, say that we've turned the clock back about 5 or 10 years, but you continue aging. And so it's important to come back for maintenance treatment so that you kind of keep resetting the clock.
Gotcha. Cool. So is there anything else that you want to leave the audience with here before we close?
Not much more than what we talked about before. Sexual health can be predate the development of other cardiovascular disease. So if erections aren't as firm as they used to be, it's important to get in to see the primary care physician who can check out your heart and other aspects of your cardiovascular health.
Yeah, good point. I mean, certainly don't want to let a cardiovascular issue slide until it's too late.
Exactly. And the other point that I'd love to make is that at the Pump Center in Walnut Creek, we really
great name, by the way.
Oh, thanks a lot. Yeah, it's short for the Pacific Urology Male Performance Center, and we really try to take erectile function very seriously. And in terms of the global way that we talk about it, first of all, our staff is all very well trained to take it very seriously. It's not a joke to us. This is a real important disease, and it's a vascular disease, and so patients typically aren't ashamed to go to a cardiologist. They shouldn't be ashamed to go to a urologist. It's basically the same disease, just a different end organ. We try to create a really nice, comfortable environment for men to come in and feel comfortable talking about really difficult things. Guys typically don't like coming to the doctors, and we try to create an environment in the Pump Center where guys actually are really comfortable to come in. We typically have old classic football games or basketball games up on the big screen. We're playing really good music. We offer guys drinks. We just got an espresso and cappuccino maker. We really try to make this a very pleasant experience so that guys don't feel bad about coming to the doctor.
Awesome. And is there a website that you want to point people to or anywhere else?
Yeah, you can go to www.thepumpcenter.com.
Awesome. Well, Justin, thank you again for taking the time and also for doing what you're doing. I think, like I opened with, it's a underserved area, and I'm glad that you're out there doing what you're doing.
Hey, my pleasure. It's great to talk to you.
You too.
Thank you for listening to Dr. Ruscio Radio today. Check us out on iTunes and leave a review. Visit drruscio.com to ask a question for an upcoming podcast, post comments for today's show, and sign up to receive weekly updates. That's drruscio.com.